We have decided that we're going to revert back to the periodic briefing. So every 2 weeks there will be a briefing of this form, and if there are any changes, dramatic or otherwise, or anything that needs an earlier briefing, that will be arranged at very short notice. But what I can say to you is that the bailiwick remains well protected, well resourced, and will be able to deal with anything that may be coming towards us. We don't believe anything is coming towards us that we cannot deal with, because, as I've just emphasised, we're well resourced. The organisation has worked well and will continue to work well. But we are concerned that the people of the bailiwick remain and feel confident. That's why continuity is important, and that's why I've got my three able colleagues on this podium. But in relation to where we are, we've decided as a Civil Contingencies Authority to make just a couple of minor changes to the rules and regulations that will be effective immediately post midnight today. And that's not because of anything that's happened here, but it is because we are aware of the concerns and the way that matters are being dealt with elsewhere. And can I just say in relation to that, last Friday I appeared as the bailiwick's representative at the British-Irish Summit, and I had the opportunity to listen and speak to the leaders of Scotland, Northern Ireland, Wales, three cabinet ministers from the UK, and the chief ministers of Jersey and the Isle of Man, just to mention a few. Now, they are all administering their COVID crisis very well and acting in the best interests of their community. But we're the only community, for any distance, that can still have people not social distancing, that we can go to functions wherever we want, that we can live as normal a life as it is possible to live with this virus still around and about us. And we will do absolutely everything that we can to ensure that that continues, and it will continue. People are concerned, some people are concerned, but they need not be, about students and people coming over for Christmas, and others will say more in relation to that. Both Dr. Brink and her team and the head of law enforcement and their team, all very competent people, are absolutely assured they'll be able to deal with that situation. So one of the journalists in their piece last time after I made my debut on this panel alluded to the bit, it was a bit like Corporal Jones. Now, and I make no apology for that when I said we don't need to panic, because we didn't need to panic then and we don't need to panic now. We are in a very good position and we want to ensure that we remain in a very good position. Now, the changes that will be effective from just after midnight tonight are twofold, and they are very small changes. We will require all critical workers on the day of their arrival, when they set foot on our landmass, to be tested. Now, many already are, and many of the critical workers that come here are tested regularly throughout that period of time. But at the moment, it's not a requirement that critical workers are of necessity tested on the day of the arrival. As I say, from just after midnight, it will be. Now, we're extremely grateful to those critical workers because they fulfill essential roles, whether it is in relation to healthcare, whether it's ensuring that our supply chains remain active and open, and they have followed the restrictions that have been imposed upon them, and we have every confidence that they will fulfil those going forward. We're also suspending, again from just after midnight tonight, business tunnel travel arrangements. We're going to honour those that are currently in force and those that are being processed, but from midnight or just after midnight, we will not be entertaining any further applications. Now, that's because, as I say, not because of any concerns that we have, but we just want to ensure that we're making and taking the best appropriate steps that we can to protect the people of the bailiwick and to give the confidence. Now, both Dr. Brink, in whom we all repose considerable confidence, and rightly so, and Mr. Hardy, the head of law enforcement, are absolutely convinced that when we have, as I say, the students and members of families, etc., returning pre-Christmas, that we have all the resources. So that is covered. That is not a concern. You don't need to listen to social media. You listen to the facts as they're promulgated here and through our press releases. Now, as I say, critical worker cases will be dealt with on a case-by-case basis with all the factors considered, and that will include prevalence rates in the countries and districts that they travel from. But we're in a position that some applications that have been approved earlier in the year and been worked through would not be approved going forward, simply because we have to be alive to what's happening around us and make sure that it doesn't happen on these shores. Now, part of the concerns that people may have, which have hopefully been dispelled and will continue to be unfounded, is the fact that there's been a change in management, as it were, in the Civil Contingency Authority. Well, you needn't be concerned. We have lots of consistency. The three people on this podium have been here since day one. The representatives from the islands of Alderney and Sark have been around for a long time. And then three new members, in addition to myself, on the Civil Contingency Authority: Deputy Barad as President of Health and Social Care, Deputy de Sommeray as President of Environment and Infrastructure, and Deputy Rob Prow as Head of Home Affairs, are all intelligent people. They've made great contributions in the times that they have been on the Civil Contingency Authority, and are fully supportive of all the steps that are being taken. Now, we've had some encouraging international news recently, but enough from me, and I'll now hand over to Deputy Salisbury.
Thank you, Peter. And I'm sure you're all delighted, as I am, to have heard the news on Monday that Pfizer and BioNTech have developed a vaccine which has been found through a late-stage clinical trial to be 90% effective against COVID-19, with no serious safety concerns. Now, various news channels regularly report the latest medical discovery that could cure this, that or the other, but this could really be a game changer. Before that news, we didn't know whether there would be a vaccine that could make a difference, but now we do. However, we mustn't forget that there's still a long way to go. We still don't know what is meant by effective. The trial is not yet complete, and the research has not yet been peer-reviewed. Most importantly, the vaccine needs to be approved by regulatory authorities around the world before it can be manufactured in large numbers, distributed and administered. For us, this will be through the MHRA, the Medicines and Healthcare Products Regulatory Authority, and they have publicly said they will not compromise safety standards to rush the vaccine out. What we do know is that we won't be able to vaccinate everyone all at once. Indeed, the current best-case scenario is that there may be limited quantities available by the end of the year. These will most likely be set aside for those living in care homes and care home staff, followed by frontline health workers and the over 80s. It'll be a while before we can undertake mass vaccination and enable the herd immunity that we will need to keep the virus at bay. So things aren't going to get back to normal anytime soon. We're probably approaching the final bend, but we're not in the home straight just yet. That means we just mustn't be complacent. We're seeing prevalence rates higher than in the first wave in jurisdictions close to us, and each of these are increasing their interventions to try and stem the rise. We are in a good place. The cluster we experience has been contained thanks to the amazing work of our test, track and trace team, who are a shining example to others as to how it should be done. The numbers who are caught up in the cluster are recovering and beginning to fall off the list of active cases. And we have a border regime that means we pick up positive cases as they arrive and can flex the isolation requirements based on the degree of prevalence of the country or region from which people come. And Deputy Fairbrash has also just set out what we're doing to tighten things up further. However, as the cluster has shown, there will always be the chance that the virus can get into the community for whatever reason. That is why we must continue to follow public health advice. Now is not the time to ease up. When we are seeing the first chink of light at the end of what has been a very long tunnel that we entered back in March, indeed, now is the time we really must do all we can to prevent any potential spread of infection. We know that washing our hands for 20 seconds is one of the simplest, easiest, and effective ways of reducing the transmissions of a virus, and we'll be launching a fun social media campaign on this shortly in the run-up to Christmas. The community has done what we have asked of it all this year, for which I am so thankful. I'm just asking that we keep working together to stay well until we get to the other end. And that's what this little flyer, which the team have put together, is all about, which you may have already got through your letterbox, and if not, you will do very shortly. It's a really useful guide to how to stay well, how to help others stay well, what to do if you have flu-like or cold symptoms, and what to do if you want to be one of our winter champions. And on the back, the symptoms to look for. Now, if you're a business, we've sent out a targeted flyer to provide information on how you can work with us to keep your staff and customers well this winter too. So please give these documents a read, because really, as we've learnt throughout the whole of this year, together we are stronger.
Thank you. Dr. Green.
Thank you very much. And I'm just going to run through a brief update of where we are and some of the information that has come out over the last week. So we are in a very good position in that we don't have any community transmission of COVID-19 within our jurisdiction. So that puts us in a very, very strong place. We've done over 21,000 tests for SARS-CoV-2, the virus that causes COVID-19 to date, and we've had 282 positives in total. Just to remind you, 252 of those positives were indeed from the first wave that we experienced. The awaiting results, we're consistently bringing that number down, and we're aiming to always be under 100 where at all possible. Now, we started phase 5C on the 28th, Wednesday the 28th of October, and since then we've detected 14 cases through our border testing policy, either through the direct swabbing at the airport or harbours, and a couple through our contact tracing process. So the border testing policies that we've put in place are working, and we've been very pleased with the performance. Overall, we've had 30 cases since September, so 30 cases in the second tranche of infections. 11 of those, of course, were related to the cluster. We've had no further cases related to that cluster. And I think that's really important, is we detected the cluster promptly. Our track and trace team worked extremely hard and extremely long hours to contain the cluster as soon as possible. And what we also did is used our extensive testing capacity to help with that control. So it's all what we planned for should we have seen another cluster. As Deputy Salisbury and Deputy Fairbrush both said, is we have real hope and with the development of a vaccine. From our perspective, it's cautious optimism, but it does give us real hope for 2021. So really exciting news for us. Now, the groups that will be immunised in the priority groups is something that I'm being asked about a lot. And there is a provisional priority list, but I do urge caution here in that we don't have the final list. And from our perspective, it may be as they analyse the results of the phase 3 trials, they may find that certain vaccines do better in certain age groups, and that might mean that the list gets modified based on that particular vaccine availability. We just don't have that data at the moment. But what is very clear from COVID-19 is age is a major risk factor. And so the prioritisation is really, in the first instance, looking at age as the major risk factor. So the priority group 1 are older adults living in residential and care homes and the staff working in those residential and care homes. And then just behind that are the groups that are over 80 in age and the frontline health and social care workers. So it's keeping our health and social care infrastructure running and looking after the most vulnerable in our society. Moving down, you'll see from the graph, from the table that I've showed there, you go to group 3, which is, for example, those aged 75 and over, down to group 6, which gets to our high and moderate risk. So those are clinical risk. So those are groups, the high risk, for example, are groups that are undergoing chemotherapy, those that have had a solid organ transplant. Lower risk groups are people living with diabetes, people with respiratory illnesses, not severe ones, so people with asthma and those groups. So that's a provisional risk stratification. Now, it's not also clear whether the vaccine would be offered to all age groups within those risk groups or not. So again, these are the uncertainties that we're dealing with, and we're sharing as much information as we have. And this, as I said, may well change if more information comes available through the results of the phase 3 trials. But we've also been asked a lot about how we're going to be delivering the vaccine within the bailiwick. And of course, we've been working on this for many months, and I think I've already shared that with you. So as with the whole of how we've managed COVID within the bailiwick, it will be a collaborative program. So we're working with partners across the whole of the bailiwick. So primary care, will be involved. The specialist nurses, occupational health services, immunising, for example, the health and care workers. Secondary care will be involved, for example, if there's particular risk groups that we would like to immunise. But also, we're planning to have a vaccination centre or centres to immunise large numbers of people in a fairly short period of time. So we're planning a joined up approach involving primary care, secondary care, our occupational health services, as well as using a vaccination centre. Now, all of those plans are fairly well developed. Now, another thing that I've been asked about is the testing strategy, and are we intending to do population-based testing? So I thought I'd just take you back one step and remind you what our current testing strategy is. And of course, we have a very broad symptomatic testing, far broader than a lot of jurisdictions. We've always had that, and it's helped us time and time again with regards to the early detection of infections. We, of course, test contacts of cases. We test travellers as well. And we test all hospital admissions going into the hospital. We have our critical worker policies. We have a program to test pregnant women. We have our pre-surgical testing program, and also some compassionate testing as well. So that, for example, relates to end-of-life visits from people from other jurisdictions and so on. So those are the current groups of people that we test. So really a fairly large group. And we are, of course, looking at, as I said a few weeks ago, looking at our bailiwick extended testing strategy. And, of course, we paused that whilst we were COVID-free for a considerable period of time. And despite seeing cases, they are now detected at the border. These are people that are in self-isolation or are contacts of cases. And so we fall into the ECDC, that's the European Centre for Disease Prevention and Control's categorization of a country that has contained and controlled COVID-19. That puts us in a very strong position. And so really then we've got to think of what we want to focus on with our expanded testing. And there really are two groups. The first is that we want to detect more infections in travellers before they can be spread into the community. And what we will be doing over the next a couple of weeks, is rolling out a second point of testing for the 14-day isolation program, probably on day 13. So before people go back into the community, we make sure that they're not a late infection. Really, really important. But we also want to look at focusing on the detection or the early detection of clusters of infection. Really important here, but what we're doing here is we're going to focus some of our expanded testing on groups that are potentially at higher risk. For example, people that are meeting and greeting at the airport, frontline staff working within the aeroplanes, within the at the airports and harbours. So those groups are really important. So, for example, the people working at our surveillance, doing the sampling at our testing tent. That's another important group. So we're looking at rolling out testing amongst those groups of individuals. Again, it's to look at the early detection of any infections. We will not be doing population-based screening. There is no indication to doing it in a population that has contained infection. So we'll be using our testing capacity in a smart way. So the other thing I've also been asked a lot about is vulnerable groups. And we've launched our Know, Prepare and Protect program, and we feel that's really important when we look at vulnerable groups. And those are people that are really vulnerable, for example, those people that are receiving chemotherapy, have had a recent solid organ transplant and so on, to those that are less vulnerable, for example, those people with severe asthma as an example. So you need to know your information, keep it up to date, know what the symptoms are, know how to seek help for the symptoms. So really important that you have that knowledge, and that's part of the information that we've sent out to every single household. So prepare. So as we move into the winter season, make sure you have your repeat prescriptions. Make sure that you have sufficient stocks of food in your house. Now, we're not saying go and panic buy, but just sensible amounts of keeping yourself stocked up with not only your prescriptions, your everyday over-the-counter medication, but also your normal food that you eat on a daily basis. And then there's the protect arm, and this obviously is something that I feel very strongly about. So that's washing your hands, preventing against infection. So washing your hands, staying at home if you're unwell. If you're an employer, support employees that phone in and say, I'm actually unwell. Support them to stay at home because they are indeed protecting our whole community. So really important from that perspective. We've also updated our recommendations on masks and face coverings, and here I'm referring to face coverings. So what we've tried to do is look at what the stratified risks should be to enable us to change from our current stance, which we're using face coverings as optimal, to where we'd actually recommend it. So at the moment, we have no community transmission. We have sporadic imported cases only. Wearing a mask is optional. So that is the situation we're in. So we're in a very favourable situation at the moment. However, should we move to a situation where we had sustained spread in the community, we had multiple cases, the prevalence of infection was rising, we would definitely change our recommendations to strongly recommend. And obviously, if we were in an outbreak situation, we'd up that even further. So again, it's looking at our local evidence to inform our decision making. Really important that we look at what our situation is, and any advice we offer sits behind the evidence that we have locally. So the winter preparedness, what we also want to do is promote the interlinking between personal responsibilities and our shared responsibilities. So important again. So the personal responsibilities, staying at home if you're sick, your hand hygiene and respiratory etiquette, really important, through to our shared responsibilities, the government messaging, adhering to our quarantine and self-isolation guidance, and when we eventually get a vaccine, is for us to be able to deliver that vaccine within the bailiwick. So that's the Swiss cheese model, and everything by itself is important at preventing that virus getting through to the person. And obviously, if some part of it falls down through the mouse eating a big hole, that really is an area that we need to focus on. So something that we want to look at very carefully, and part of our shared responsibility, and really so much in line with Guernsey Together over the winter period. And I finally wanted to say something about students, and I really would like to encourage everyone to welcome our students back for Christmas. They've had a really difficult term, many of them. Many of them have been learning in circumstances that are entirely unfamiliar. Some of them would have been over, if they're their first year, it'll be their first time at university. The experience will have been completely different. My experience of students that have returned is that they are adhering to everything that we're asking them to do. And I actually have a lot of them phoning me to check that they're doing the right thing. So there's a degree of anxiety to make sure that they are doing the right things. I'd want us to say, let's welcome our students home. It's great to have them home for Christmas. Let's say, please all stick to the rules. But I think it's important that we have a positive approach to our students coming back. And I think that's all I've got for today.
Thank you very much. Thank you very much. As usual, Eddie got a positive note. Paul.
Thank you. Since our move to 5C on October the 28th, we've had over 1,000 travellers use the travel tracker, with the majority of those travelling managing to complete the forms and submit their details online before departure. This is hugely valuable information that directly assists the performance of our track and trace operations. Unsurprisingly, there has been some minor issues since we launched that have resulted in longer than anticipated queues on occasions. However, I would emphasise, as much as we are trying to make this a reasonable experience, we must acknowledge the requirements moving through the borders are significantly different to that of normal travel arrangements. And I would ask all travelling and those that have family or requirements for critical workers to bear with those staff managing these operations at the ports of entry. As Dr. Brink has said, we have detected 14 cases of COVID-19 through our border testing policy, all through contact tracing. This is in line with our modelling, so nothing unexpected has been detected so far. With small numbers have started to return, we will soon be welcoming home, as previously mentioned, our off-island students. These include those from university, boarding schools, and indeed special needs placements. A huge amount of work has gone into ensuring there was sufficient and appropriate capacity so that this section of our community are supported if they wish to come home for Christmas. The announcement from the UK government yesterday, in which it outlined when students should return home from university, illustrated the importance of our pre-planning in this area and ensuring we get our students back with their families for Christmas. We have maintained regular direct contact with students, and we continue to provide them with information and support so they are fully aware of the latest advice before they travel. Although contact has already been made with the majority of students, later this month we'll be sending them a pack of information that will cover self-isolation requirements, what self-isolation means in practice, and what they need to know before they travel, advice about greeting loved ones at arrival at the airport and travelling home from the airport, and indeed much, much more. We have also created a new page on the States of Guernsey COVID website specifically to further support returning students. So I would encourage them, and importantly their families, to review the information there. I'd like to recognise the hard work of officers and the Committee of Education, Sports and Culture that has made this all possible in such a short time. It is, however, worth noting our returning students, as point made, are no different to anyone else travelling into the island that require an immediate 14 days self-isolation. Maintaining the requirements in self-isolation are not only important to those individuals, but doing so correctly helps safeguard the protection against COVID for our entire community. As mentioned by Deputy Furbrosh and Dr. Brink, work to prepare for COVID-19 vaccine has been ongoing in parallel with the management of the pandemic across the bailiwick. There has been close liaison with Public Health England, who have provided advice and support around this new vaccine in line with the recommendations from the UK's Joint Committee for Vaccination and Immunisation. The UK government has developed a large vaccine portfolio, and we currently have no confirmation on which vaccine we will receive, but it's likely that there may be more than one vaccine for COVID-19 available to us. This entails a considerable amount of work by multidisciplinary teams across the states to plan against a variance of eventual requirements to administer and to distribute the vaccine. We have no exact date as to when we will be able to begin the vaccination programme, but we anticipate that we will have limited stocks in the bailiwick before the end of the year. This will increase at some point in the new year, and we are also planning for the potential location, fitting out and resourcing of mass vaccination centre or centres. As vaccine stocks will reach us in phases, we are working on the priority groups as identified by the Joint Committee for Vaccination and Immunisation. As Dr. Brink has mentioned, ranging from older adult residents in home care homes to all those 50 years age or over. Work is now ongoing to confirm those priority groups and identify individuals within those groups who will qualify for a vaccination. It's important to note that this will remain a voluntary programme. Our pharmacy and procurement teams and logistics specialists are working together to ensure we receive our allocation of any available vaccine in a timely and safe manner. Importantly, we're very grateful to be working with our primary care partners across the bailiwick who help and support will be absolutely vital in order to roll out the vaccination programme in a timely manner. Lastly, and in order to provide improved support and processing of those staff managing the approvals and changes to critical worker permit process, we are changing the telephone contact number of the team that handle these applications. The new number is 01481 747 578 and also will be published on the COVID website. Thank you.
Thank you. I think I'm grateful to all my all my colleagues for their contributions. But now it's the media's chance to ask us questions, and we await their questions. And I'd be grateful if, as normal, when somebody asks a question, they identify who they are. So who'd like to? Yes.
Hamish Ascari from MyTV Channel. Given we rely on the UK government to deliver us any potential COVID vaccine, can we rely on that jurisdiction to provide it in a timely way and in the quantities that we need here?
Well, I'll ask Dr. Brink in a moment, but I think the answer to that is yes, as best we can. Dr. Brink's already covered, of course, the issue of the vaccine, and as Mr. Whitfield said, over the period of time there will be various vaccines from various groups, and all of those will be considered, and we'll do our best to get the stock as best we can and disseminated, distributed as best we can. Dr. Brink, is there anything you want to add?
Yeah, we've been assured that we're part of the procurement chain and we'll get a proportional allocation based on our population size.
Thank you. Any other questions? Yes.
Zoe Fitch from the Guernsey Press. On the decision to test critical workers on their arrival, why has this decision been made now when, especially as UK cases began to rise in mid-September? Is it an indication that the cluster that we saw was set off by someone travelling on a critical worker status?
Well, I'll deal with that initially, and then I'll ask Dr. Brink if she wants to add anything. But in relation to that, you make decisions on the basis of the facts as they arise. And I don't believe if there was an inference of that question that it should have been done earlier, I would reject that, albeit I wasn't part of the Civil Contingency Authority at that time. It was a decision that we made this week on the basis of the fact that we are aware that other jurisdictions not far from us have a high degree of prevalence, and that is a matter of concern are the actions that they have taken. All that we are doing is taking decisions that we believe are in the best interests of the bailiwick.
I'd just briefly
that's
say,
fine,
yes,
yeah.
prevalence rates are going up, but earlier on, but at this present moment in time, we're very concerned about the prevalence rates in the UK in particular. They're still rising. I think the number of cases went up 50% in a day.
Yesterday. Yep.
Just yesterday. So that's why we're doing it now. But there's no indication that we should have done it earlier or not. But now, from the evidence that we've got, now we believe it's a time to tighten up.
Do you want to add anything, Dr. Brink?
Yeah, and we're in a position of strength because we don't have any evidence of community transmission within our bailiwick. So what we want to do is maintain that status whilst we await a vaccine.
Paul?
Just to say that some critical workers have been tested, some critical workers have been tested every day, and some have worked in a very isolated fashion. You've got to look at the cohort and the reasons for them. Some fly in and have actually done their job and left on the same day. They're very, very much details based on the method statement that's appropriate for the individual critical worker. And that's the quite extremely in-depth application process that assesses it, good point made, is because of the prevalence elsewhere, we're literally just tightening up a couple of notches in our belts to make sure we're as secure as we possibly can.
Next question. Yes, Betty.
Maisie Foot, Bailiwick Express. If we are halting business tunnels for now, is it safe to continue with the ones that have already been planned?
Again, we thought about that, and we believe it is because the resources are here to be able to police those, to make sure that they are that they go through with no difficulty. So there aren't that many anyway. We've not exactly been overwhelmed with them, but those that are planned and have been approved are not going to cause us any difficulty. If we thought they were, we would have cancelled them. But in a balanced and moderate way in which this has been dealt with, there's no need for that to happen. I don't know if anybody wants to add anything, Dr. Brink.
No, I think that's fair enough.
All I would add is there was less than 6. There's only 2 current being processed. And the reason being, and I think we must thank particularly the finance sector, who were very much, it was only used as and when required for very, very specific reason. And again, so it's just a further message to make sure we know our border is our best line of defence. We know our border is also our biggest vulnerability if we don't use it correctly.
Yes, Oscar.
Hi, thanks. Yeah, Oscar from BBC Guernsey. Just on those business tunnels, would you be able to tell us what proportion of business tunnel applications over the last few months that you've actually approved?
I haven't got that statistics to hand. Paul, have you got that to hand?
I haven't got the statistics. It's quite low in numbers, and it's for specific requirements that required someone to be present on highly complex cases, and very stringent method statements again about how they were operated were used, and used very sensibly by the industry. Again, as a point well made, very, very small numbers.
But I think we could. I think we could let you have those. Those figures are available.
Absolutely.
It's just I don't.
It's only just to be absolutely clear that I appreciate that you're saying there's might have been a low uptake, or to quote you haven't been overwhelmed, but I just wonder whether you've rejected a few as well.
Yeah, we've rejected critical workers, exemptions, social, community, and business tunnels as necessary.
Any other questions?
With business tunnels now being cancelled, a further closure of our borders, can we now expect to not see any relaxation now until any COVID vaccine becomes available? Is this it now until we get a big development on that front?
The answer is everything's kept under review, and I don't want to give a diplomatic answer because that isn't my skill set. It's the point in relation to that is that I think it's unlikely that there'll be any material change, but it will depend on the facts. We'll look to our advisors. If our advisors say, for example, in 3 weeks' time, we can open up again business tunnels, or we can make certain relaxations to critical workers, that will be done. I think it's unlikely just at the moment, because as you've heard from Dr. Brink, again, a vaccine, and Deputy Salisbury, a vaccine is on its way, but it's not going to be the panacea of all ills initially. It's going to take a time. There'll be other vaccines, and matters will have to develop over a period of time. There's not an instant cure.
I think we need to look at as well how lockdown impacts England. And we're not seeing the impact yet. We didn't expect to for probably another week, because they've been in lockdown for 1 week. Another week they might go down, but then we have to assess whether we're happy with where the prevalence levels are going. So it's very much based on what's happening around us.
Dr. Brink, do you want to add anything?
Just the prevalence of infection, as Deputy Salisbury said, is a critical fact. The other thing is that the seasons are against us. We're entering winter, and respiratory viruses are more common in the winter period. So it's everything together, and as Deputy Fairbrash said, we keep this under constant review and only put in restrictions. For example, as evidence what I showed you with face masks and face coverings, we only recommend restrictions that are supported by evidence.
Any other questions?
Just
Yes, I'll go to the lady
Sorry,
at the press,
please.
because you've already asked a second question, but you can have a third one, don't worry. Yes, what would you like to ask?
Press. As part of the response to COVID, Islanders were encouraged to have a flu vaccine this season. Can we get some more information about how well that supply chain has held up, how many people in particular categories have been vaccinated and how many are still waiting, and if there's something that can be learned for the rollout of the COVID vaccine?
So I can't give you exact numbers through all the groups, but we have that information available. With regard to our vaccine supply, is that we've had an incredibly good uptake of the flu vaccine this year. So we're aiming to hit the 75% target, which is what we planned for. And that vaccine supply should match the number of people that are coming forward for immunisation. However, there were delays in some of the vaccine delivery. And we recently, the quadrivalent vaccine, which is the vaccine for the under 65s, we recently got a large delivery on that, so we're hoping to catch up with that group. I think you raise a really important point, which is the whole issue of secure vaccine supply chains and so on, and that's something that we work on all the time. So from a point of view of are we looking at that, and are we looking at the COVID vaccine supply chain? Absolutely. And it'll be even more complicated for the COVID vaccine, because there are likely to be 2 different vaccine types at least that are offered to us for use. It's also going to be likely to be 2 doses of vaccine. And if you have a dose of COVID vaccine A, your second dose has to be COVID vaccine A as well. So we have to then work out per vaccine exactly, and per group exactly how many vaccines we need. So all of that is factored into our preparation, and we have a whole group looking at that. So it is very complex. With the COVID vaccine, we also have to ensure that there's about a month delay between the flu vaccine and the COVID vaccine. So there are a number of very intricate details, and yes, there's a huge amount of planning, and yes, keeping an eye on the supply chains is going to be incredibly important.
Thank you.
I understand the Pfizer-BioNTech vaccine requires it to be stored at minus 80 degrees or thereabouts. Does that pose a problem to procurement for an island jurisdiction like ours?
So it's something we've planned for. So we knew from the beginning that it was likely that we get what's called an mRNA vaccine, which the BioNTech one is, and that requires storage at minus 70, minus 80. You've got about a 4-day window after you've reconstituted the vaccine to actually administer it, so we've factored that into all of our planning. We procured minus 80 refrigerators in advance of that because we knew it was highly likely that we'd get an mRNA vaccine. So that's been factored into our planning. It is logistically very challenging, as you can imagine, and it is requiring a lot of planning and a lot of late nights, as you can imagine, but we're doing what we can to make sure that what Zoe brought up and what you've brought up, that our supply chains are as secure as we can make them.
Any other questions? Oscar.
We have a new President of Health and Social Care, the committee here in government. Might you advise on whether you're hoping or expecting him to be an active part of this panel, these briefing sessions in the new 2 weekly format that you mentioned?
It will depend. I mean, it may be that I'm not here on occasions. It may be that Deputy Salisbury is here on occasions. We look at it for each individual session and decide, bear in mind there's only a limited period of time, how we can best spend that time giving information to the public, which is the main reason for, the only reason for these, this session really, and the sessions that we have, and to answer the perceptive and difficult questions that the media occasionally ask us. Any other questions for anybody? Well, thank you. I'd just like to conclude. I'd like to say this. To the people of the bailiwick, as you've heard from my able colleagues, be careful. If you're careful, you could be happy, and that we can continue with a unique position that we are in, enjoying our lives as we do live them. But there's two other things I want to say, and they're both thanks. The first is a general one to the people of the bailiwick. The way that the people of the bailiwick have overwhelmingly reacted to this horrible crisis and the restriction on civil liberties over the last 8 or 9 months or so has been wonderful, absolutely splendid. It shows what a unique place we are, what great civic responsibility we have, and what a good and decent population that live in these islands. And secondly, thanks to Maisie Foote. She's asked a question. I understand this is her last media session because she's going off to a new career. So thank you very much, Maisie. I understand you've been asking questions, and you asked again a very good question throughout the last 9 or 10 months or so. And we'd like to thank, it's not very often that I do this, but I thank the media for their sensible and balanced way in which they have contributed to these sessions and beyond. And they've also asked the politicians and the advisors, as they should, difficult and interesting questions. So we thank you for that. I think that probably brings this broadcast to an end. And as I say, to the people of Guernsey, the people of the bailiwick of Guernsey, keep safe and we'll do our absolute best to make sure that we keep you safe. Thank you very much.